Hi, my name is Bill Barberg, the president and founder of Insight Formation, and my firm helps health departments, hospitals, and multi-stakeholder coalitions address complex issues like chronic disease prevention, the opioid crisis, adverse childhood experiences, social determinants of health, and other wicked problems. We help guide the development of robust, zoomable strategy maps that then become the framework for the development, measurement, and implementation of strategies to address these issues. Strategy maps and strategy management practices help tame the complexity of what otherwise can be an overwhelming number of details that are part of a comprehensive strategy. In the past few years, we've helped launch 3 open source strategy map templates and resource hubs that are built on the same platform as Wikipedia. These are free platforms that we transition over to an appropriate national nonprofit organization to help carry them forward, so they can be a nationwide place for sharing information, resources, and links to other sites that have more detailed information on specific parts of a strategy. The purpose of this video is to raise the possibility of creating a similar comprehensive strategy map template to support the details of the CDC recommendations and public health guidelines and practices to address the complex issue of the COVID ID crisis and strategies to address the multitude of ripple effect issues that we're just beginning to experience. And this would in no way be an attempt to try to create anything or to provide information that would be an alternative or inconsistent with the CDC and the public health guidelines. Yet these tools would help organize the recommendations into a well-structured and dynamic strategy, and it would create a place to clarify and communicate additional details to manage the implementation of this guidance. Ideally, this comprehensive strategy map template would be managed by the CDC. The value of strategy maps and strategy management practices is gaining a lot of appreciation. In May of 2020, I'm scheduled to present at the Collective Impact Forum's annual convening on accelerating collaboration using strategy maps and strategy management technology. At this summer's ACHI conference, which is essentially the American Hospital Association's Community Health Improvement Conference, I'll be presenting on the use of these techniques for taming the complexity of dealing with adverse childhood experiences, or ACEs, another very complex issue. I was recruited by the Public Health Foundation to write the chapter on implementing population health strategies for their book, Solving Population Health Problems Through Collaboration. And in 2018, I received the Health System Transformation Award from Communities Joined in Action for the work in applying these sorts of techniques and tools to help address the opioid crisis. So I want to give you a quick tour of the strategy maps and resource hubs for the opioid crisis and ACEs. And as I show you these, think about how this type of structure could be useful to help manage the long-term strategy for addressing the COVID-19 crisis, because we're not going to be over this in a few weeks. The Opioid Coalition Resource Hub, or OCRH, is furthest along, and we've transitioned ownership of the OCRH to SAFE Project, a national nonprofit started by a U.S. Navy admiral. In the OCRH, we have a comprehensive strategy map for addressing the opioid crisis. And the top has some of the outcome objectives, such as reducing crime, law enforcement in corrections costs, decreasing babies born with opioid dependence, and of course, reducing deaths. But also things like fewer people becoming dependent or people being successful in long-term recovery. Beneath that, we have a full comprehensive set of strategies, thoughtfully organized in a format where the cause and effect logic flows up. I won't go into details, but we start over on the left with strategies for prevention, then strategies for early intervention, like reducing access of opioids for misuse. And we can see drivers of this would include reducing overprescription of opioids and reducing the diversion of prescription drugs. Any place on the strategy map where we have a plus, we can click to zoom in to more details. This is what we mean by zoomable, sort of like zooming in on Google Maps. Now we can see that there are many ways to support reducing the diversion of prescription drugs, such as improving safe storage of prescription drugs and expanding prescription drug take-back and disposal programs. We'll see later how clicking on these objectives can bring up a great deal of additional valuable information. Clicking on the minus takes us back up to the top level map. If we zoom in on the plus here for prioritize SUD treatment over incarceration, we can see more details. In this case, the strategies are organized into alternatives to arrest, adjudication and sentencing, during incarceration, and reintegration after release. If we look at one of these, expand programs similar to the Angel program, we can see the kind of details that we then have in the OCRH. This is designed to have a familiar look like Wikipedia. And as I mentioned, it's built on the same platform, but we can have much tighter controls over who gets to update information. But we have background, different programs, evidence, and links for tools and resources. And here we can bring up different resources and point to different websites that have valuable information like the Police Assisted Addiction and Recovery Initiative or the Michigan State Police Angel program or nonprofits that have gathered information. So this allows people working on a topic like this to quickly access the best information out there that might be developed in different states in parallel in the case of the COVID-19 crisis. Clicking here takes us back to the prior page, and we can even look at different details like how might we build scorecards, what kind of measures would we use. That information can be built up over time. Next, I'm going to show you a strategy map and resource commons that is earlier in development. This one is the ACEs and Resilience strategy map. To rapidly build out a comprehensive strategy map for ACEs and Resilience, we started by looking at dozens of strategies from different states and organizations, research reports, and begin to organize them in a systematic way. That gave us a starting rough draft. We then assembled 10 coalitions from around the country and began working with them on different parts of the strategy map in regular web conference calls so we could build out more details and get input from different people in different areas that everyone could benefit from this increasingly comprehensive big picture. If we look over here, we have objectives around starting healthy, around minimizing exposure to ACEs and trauma, and expanding trauma-informed practices in all sectors. Again, if we click on this, this can take us to a page with many different sectors. And you could imagine something like this for the COVID-19 crisis, where there may be things that could be done in schools, in preschools, for employers, for dentists, for all kinds of different sectors that could be working on. And as we would work potentially with different states, with their health departments, working with national organizations, we could have different details for different sections. Here, in expanding trauma-informed educational practices, we worked with coalitions that were doing a lot of work in schools. When we get started, we have basically blank templates for each one of these objectives. So for example, if I click on Expand Trauma-Informed Philanthropy, it comes up with a template that allows us to see basically a place to be where additional information could be put in. And so different groups can be working on this across the country, working very closely in coordination, hopefully with the CDC, with the top health departments, but not have to have everyone work on reinventing the wheel. Hopefully that gives you a little bit of an idea of these tools.